Hi, everyone. Let me go through the questions, answers, and rationale for Exam 2 in our healthcare ethics class. What I have in front of me is the team exam. You recall the individual exam has the choice of the two short essay questions. So I'm not going to go over that because it will be different for each of you. And as long, so I'm just going to go over the team exam, which has all of the same questions except for an additional one. Okay, so first one has to do with Jean. She's 22. She's admitted to the hospital with these symptoms. The lab tests reveal cryptococcal meningitis, an infection commonly associated with HIV infection. When given the diagnosis, she adamantly refuses to be tested for HIV. Question is, how should the clinical staff react? So you have to really understand what's happening in here with this question. We don't know for sure if she is HIV positive. She has an infection, she has meningitis, and it's commonly associated with HIV, but this is not about the disease, this is about consent. How should the clinical staff react? So this has to, because she's of age, because she doesn't indicate anything else except she has intact mental status, which means she's cognitively able to respond. Really, the testing, hold on one second, the testing for HIV or for anything should be done only with the informed consent of the patient. But even though she refuses, she can't be tested. Now, again, understanding that we don't know if she has HIV or not, but she refuses for whatever reason. And so the rationale here has to do with autonomy. And autonomy goes both ways. Autonomy is not just saying yes, it is also perhaps saying no. And that is connected to the idea of informed consent. Okay, second question has to do with the 4 Indiana women who are undergoing an elective abortion. Now, I think I explained this to many of the teams today, or many individuals. You know, we've talked about Senate Bill number 1, which is the new Indiana abortion law. It is temporarily on hold, but you don't really need to worry about that to respond to this question. And I will tell you, this question is more connecting the facts together. So even though, of course, I ask you always to focus on the ethical issue for the case, for every question, this one really is more about facts. So the question asks, with all these characteristics, which woman will most likely undergo the procedure? So let's just go through all 4. First one is QAR. She's 32. She's Black. Median household income is the highest. She has private insurance. She has a slight risk in terms of her pregnancy. She's 23 weeks pregnant, so she is certainly farther along than anyone else, which is really past the point of viability as well. And she's almost in the 3rd trimester here. So it's, you know, it's risky for an elective abortion. Letitia is 17, so she's under the age of majority. She's Black. She has a lower median household income, but she has no insurance. She falls within the window to have an abortion, but how's she going to pay for this? And she's underage. Maria is 20, Hispanic, no household income, Medicaid, and 10 weeks pregnant. So she falls under the timeline for a surgical abortion. Medicaid in almost every state does not pay for elective abortions, as we discussed. And then how's she going to pay? Shelby, 25, white, higher household income, private insurance, falls within the window for a medical or surgical abortion. Really, these things indicate that Shelby is the one who will go through with the elective abortion. And so that's really the key part here. She falls under all the categories. Private insurance will pay for abortion as well. Third case has to do with the case of the prejudiced patient, which you'll find in the Blackboard site on September 20th. Understanding what the case asks. What is the ethical issue, if any, when comparing race concordant preference with gender concordant preference? So the idea of concordant means to align, to connect. And it is preference. This is when we start talking about bias. But preference, which is a bias, is based on race, but it could also be based on gender. And the example that we talked about in class is if a female patient is requests a female OBGYN, we tend to honor that as a healthcare system. But the question asks, what's the ethical issue when comparing a race concordant preference with a gender concordant preference? And specifically to this case, what was the issue in this case? Well, we have a Black woman who has an interaction with a Black physician. She says, would you be my doctor? That's a race concordant preference. There's nothing unethical about that. In fact, a lot of times, especially for minority groups, we hopefully might be able to honor that. Sometimes it's pretty hard, though, to do. But in the same way we would honor a gender, we would attempt to honor a gender concordant preference. But she also said, you know, it's hard for me to understand my other doctor, Asian physician. Okay, well, that's a comment. That might be true, and that might lead to confusion. But then she says something, we let too many immigrants in this country. That really crossed the line in terms of racial bias. This patient, the patient here displays racial bias against her physician. The other issues are partially true, somewhat true, but if you're going for the ethical issue here, which is bias as well, and bias was demonstrated by the comment about immigrants, not so much the comment about, will you be my doctor? That's really a preference. It is a racial bias against her current physician. Question 4, Susan is a Christian. She objects to abortion, but she also works as a nurse in the emergency department. Over the last year, she's assisted on 2 cases, abortion cases, both occurring after rape. Which statement below best represents Susan's ethical stance? So really, it's what we've been talking about. She's opposed to abortion from an ethical perspective, but she still supports the law, the fact that it exists. Now, in her cases, because she works in the emergency department, she assists on those cases. And of course, they both have occurred after a rape. Some might think, well, doesn't she leave her personal beliefs at home and she doesn't bring them to work? That's true. It's not really the ethical issue. The ethical issue is opposing abortion from an ethical perspective, but also supporting the law. So it's law and ethics combined. Okay. Question 5 has to do with uniting 2 conflicting themes, honoring conscientious objection and supporting patient autonomy. And that's really the challenge here. We want to, as much as possible, unite the themes, the ethics themes, but it's challenging sometimes. Which one of the 4 examples below at least comes close to uniting the themes? Dr. Smith objects to providing the treatment to Mark. We don't know what the treatment is, but he objects to it. So he objects from a conscientious perspective, but does not interfere, will not stand in his way with his ability to seek care elsewhere. Supporting autonomy. Now, it might be a small burden for Mark to receive the care elsewhere with either another provider or another location, but it really is attempting to bring the 2 themes together. The other 3 examples don't get close to that. 6. Now, 6 asks an interesting question. It says, what's an example of Dr. Roberts not following his conscience when he practices medicine? So you have to go through all 4 of these and determine what are his beliefs and why it sometimes doesn't he follow his beliefs. So why don't we go through all 4? Dr. Roberts is devoutly religious. He continues to practice medicine in a faith-based hospital and does not allow birth control to dispense on his premises. Those all align with each other. B, Dr. Roberts strongly supports the role of Planned Parenthood. We discussed Planned Parenthood in class. The link to one of the Indianapolis locations is on your Blackboard site. But in this case, he refers some of his patients to this organization to receive RU46, which is medical abortion, which they provide, by the way. We not only discuss it, but you should be able to see it on the site. So that aligns. Dr. Roberts will not discuss the morning after pill with his patients. So that's a statement. We're not really sure what his beliefs are, his values. We just have the statement. D, he's strongly opposed to abortion from a religious perspective. Got that. His physician partner, Dr. Orr, does provide free samples of the morning after pill to her patients only. So he's not providing it, but he is in a practice where his partner is providing the morning after pill, Plan B, to her patients. So he is connected to the practice. It's an example of really not following his conscience, even though, he's strongly opposed to it. Now, the morning after pill is not necessarily abortion, but it has been linked to it, and that was the case of the pharmacist and not dispensing morning after pill to patients who come in requesting it. So really the response is D, and you want to make the connection between, might not be him, but in his practice, he is really allowing it to occur, even though he's not directly involved. And the last question has to do with the very short unscientific survey that we did in class about the statement, pharmacists across the country are refusing to fill prescriptions for birth control. And the results from all of you were 11 agree with the pharmacists, 27 disagree. What conclusion can be drawn? Since the majority of you disagreed with the pharmacist, it really means that you agreed with the autonomy of the patient to be able to access their prescription as they need it. And so access to care should take precedence over the healthcare professional's conscientious objection. And really then aligning it in the response. Okay, I hope this was clear, understandable as well. If you do have questions, let me know for sure. All right, thanks very much, folks. Appreciate it.